My name is Pat Ryan-Krause, and I'm a pediatric nurse practitioner here at Children's Medical Group, and I've been here since 1990, so that's about almost 17 years I've been here. And I've been a preceptor actually for most of those years. The most fun things about being a preceptor is you really get to share your enthusiasm for being a nurse practitioner with young students and kind of help the next generation of nurse practitioners to develop.
Pat's really wonderful about helping me think through what I need to accomplish in the visit and really sort of setting up kind of a checklist in my mind before I go in, and then sort of helping me to organize that information when I come out and give report to her at the end of the visit.
I think one of the important things about being a preceptor is bringing students from novices to really competent, careful clinicians. And I think that's part of the fun of it, to start out with someone who's young and who may not have much experience, and to show them, you know, with simple visits, working up to more complex visits.
And it's a really powerful thing, and I think really, really strong preceptors are amazing people who I definitely look to for advice in practice, but also in career advice and in just sort of thinking about what I'm doing next in school and in terms of looking for jobs and stuff.
One of my students is now in Washington, D.C., and I am in contact with her every time I go to D.C. We have coffee together. I have followed them through getting their first jobs. It's really important for preceptors to feel comfortable in contacting the faculty back at the nursing school, because you'll be precepting in conjunction with a nursing program, and there'll be faculty there that you can always contact if you have concerns and if you see those red flags going up and the student's not quite getting it. One of the rewarding things about being a nurse practitioner is the relationship that you establish with your student. And I think that relationship is best if it's really built on mutual trust and mutual respect, and that you trust the student to let you know when they're struggling, and you respect that struggle and you help them with that struggle. And also that they respect what you have to do, when you have to stay on schedule, when you have to kind of hurry them along, and those kinds of things. So it's basically based on communication and trust and respect. And I think that you can have a really enjoyable experience. And it actually makes you a better clinician, I think, to be a preceptor, because many students will ask you why you did something, why you didn't do something that they've learned in physical assessment class. And it makes you really think and makes you verbalize about what you've done and why you've done it. And I think that ultimately makes you a better clinician as well.